Hello everyone. Now we can go to discuss about the visual pathway. We know that visual cortex is located in the occipital lobe, and there are two fields in that: temporal field, nasal field. Okay, and here the important point to note is nasal fibers are going to reach the temporal field, and temporal fibers are going to reach the nasal field. Okay, and in left there is eye. In retina there are 10 layers. We are going to discuss mainly about the ganglion layer. In ganglion layer, which carries the nasal and temporal fibers, and which forms the optic nerve, which joins to form the optic nerve. Here the optic nerve here the optic nerve joins to form optic chiasma. In optic chiasma, only the nasal fibers join and temporal fibers separated. Okay. In the optic tract, left side optic tract, there is left side temporal fiber and right side nasal fiber. Right side optic tract, there is left side nasal fiber and right side temporal fiber. Next, the second order, these are the second order neurons. These second order neurons going to relay in the thalamus. We know that thalamus is the relay center. In thalamus, lateral geniculate ganglion, lateral geniculate body is the visual relay center, and medial geniculate body is the auditory relay center. Here, the lateral geniculate body, these fibers relays, and from there it goes to reach the visual cortex. These fibers are known as geniculocalcrine tract, and when it reaches the visual cortex, we are going to see the object. Next, we can discuss about the various lesions and its consequence. Okay. Now, here the lesion is A lesion, where there is the lesion of left optic nerve, which results in total blindness of the left eye. Next, here is the B lesion, which is the lesion of right optic nerve, and there is a total blindness of right eye. This is known as anopia. And there is the C lesion, which is the lesion of lateral fibers in the left side of optic chiasma, which results in left nasal hemianopia. Then next, the D lesion. This is the lesion of lateral fibers in the right side of optic chiasma, which leads to right nasal hemianopia. Next, we are going to discuss about C plus D lesions, which results in lesions of lateral fibers in both sides of optic chiasma, which results in binasal hemianopia. That is, nasal field both sides is lost. Okay. Next to the E lesion, that is the lesions of medial fibers in optic chiasma, which leads to bitemporal hemianopia. And there is the F lesion, which is the lesion of left optic radiation, which results in right homonymous hemianopia. Then next is the G lesion, which is the lesion of right optic radiation and which leads to left homonymous hemianopia.